Hello everyone, my name is Srinja and I'm going to be conducting a community needs assessment on West Jasper Place, Edmonton, Alberta, Canada. This community is located in west of Edmonton. It is an urban residential community. The total population of this community is 3,285 people. There are a total of 1,696 dwellings. Majority of these dwellings are 4 stories and up, and they belong to the construction period of 1961 to 1980. The estimated cost of this dwelling is $400,000. The estimated monthly cost of a rented property is about $1,000, and about owned property is about $1,500. Majority of the population living in this community are Canadian citizens and are of Asian descent. So of the 3,285 people, about 48.2% are of the working age category, 14.5% are of pre-retirement age category, and 14.1% are children, 11.9% are youth, and the remaining 11.3% are seniors. So about 91.8% of the population living in this neighborhood speak English, 5.7 speak English and French. The top 5 mother languages of this community are English, at 58.6%, followed by Tagalog, Cantonese, Hindi, and Malayalam. Out of the total population, about 36.8 were married, 35.2 are single, 10.4 are living common law, 8.5 are divorced, 4.6 are widowed, 4.4 are individuals that are separated. So there are about a total of 805 families living in this neighborhood. Of these families, about 55.9 of them consist about 2 individuals. The average family size of this neighborhood is 2.7. The household income ranging from $10,000 to $30,000 consists of big groups of individuals, which are about 32.2% of the community. The highest level of education in this community is a college or another non-university degree, and majority of the individuals in this neighborhood are in sales and service occupation, which is about 31%. So now we proceed on to the methodology. The precede and the proceed model was utilized for conducting the community assessment. And for this model, phases 1, 2, and 3, 4 of the precede were utilized. The entire assessment is comprised of following component: windshield survey, followed by the interviews with community and healthcare leaders, and quantitative data obtained from City of Edmonton and Government Alberta's websites were utilized to create the socioeconomic demographic profiles and the health profiles of the community, and information from the survey, interview, and the quantitative data were compiled to create a list of the community assets, capability, and resources. So these are the following windshield observations. There is a great accessibility to amenities by car. All the utilities such as the grocery stores, dining-in facilities, fast food restaurants are located within 3 kilometers of distance in the community. The community consists of a park in the name of Arthur Elliott Park. And this park has sidewalks for people to walk and to ride bicycles. There's one elementary school located within the community. Schools for other levels of education are located outside the communities within 3 to 5 kilometers of range. Public transportation is available to commute to these areas and throughout the city. A local medical center and public health center and pharmacies are located about 4 kilometers of the community, and a community hospital is located 4 kilometers from the community. Now moving on to the interviews, I interviewed the ward counselor of this community and a very well-known family physician in Edmonton. So the ward counselor's main goal is to make this community into a 15-minute model, which means that the individuals living in the community will be able to access all the amenities such as library, church, school, pharmacy, hospital, grass, groceries, and food within 15 minutes of distance by foot, as he believes accessibility is the greatest concern of this community. As everything has to be traveled by a car, which might not be possible for some people who are of a low socioeconomic background. But apart from this, the ward councillor also appreciates the community for its diverse range of population, low-cost housing, and he believes that having a community hospital, which is the Misericordia Hospital, um, within 4 kilometers in vicinity, as people can get help immediately in case of emergencies and in general. The family physician believes that the prevailing health conditions majorly depend on the age groups. The higher incident rate of diseases in low socio community are due to lack of funds, awareness, and education about the healthcare issue. And the family physician also stated that the physicians in the Edmonton are affiliated with several programs to which they can refer the individuals of low socioeconomic background so that these individuals can get help at low cost or free of cost. So the health profile is created using the data from City of Edmonton and the Government of Alberta website. So in the prevalence rates reported from chronic disease, in all of 132 local geographical area, West Jasper Place is ranked 97 in hypertension, 75th in diabetes, 118 in ischemic, 102 in COPD. Hypertension is the highest medical condition with the highest chronic disease prevalence rate in West Jasper Place in time periods of 2008 to 2015, followed by diabetes, which actually saw a factor of 0.18 increase over the years. So these are the mortality rates, and of these, neoplasms are the highest with 167.5 per 100,000 population, followed by circulatory system and external causes. This pie chart represents the top 10 deaths, and the top 10 causes are the neoplasms, followed by disease of the circulatory system, disease of the respiratory system, external causes, mental health issues, diseases of digestive and endocrine system, and other diseases. So 12 indicators are identified to explore the primary care needs in West Jasper Place. And these are the 12 health indicators. And of these indicators, indicator number 2, which is the volume of family physicians, indicator number 9, which is the percentage of influenza victims, indicator number 12, which is the life expectancy and births, should see a higher rate than stated here, because it is pretty lower rate than the average rate for the West Jasper Place, and rest of the indicators should see lower rates than stated here. So now we are going to talk about the assets, resources, and capabilities. So the community is located near the Jasper Place Public Library, which is part of the Edmonton Public Library, and this provides free educational services for all the ages, and it also provides study spaces for all the age groups. And the West Jasper Place Public Health Center and Misericordia General Hospital provide many programs that target issues such as substance abuse, physical activity, diabetes, and vaccinations, which are free of cost. And the primary care network also offers programs for physical activity, mental health, education about positive behaviors, health issues, nutrition, fitness, and weight loss. All the services offered by the network are covered under Alberta Healthcare services and are free. The physicians refer the patients of low socioeconomic status to this network. The patients of low socioeconomic status are also eligible to get a free access to all community recreation centers to exercise through a program called Prescription to Get Active. And there is also a community league that focuses on the community issues, and which is a part of Edmonton Federation of Community Leagues. And this also aims to bring the positive changes in the communities. So the priority health issue is obesity, and this is chosen based on the Hanlon method. The priority score is not calculated due to the lack of information available. However, due to the magnitude of the problem and the size of the issue, obesity is chosen as the priority health issue. And these are the three recommendations. So the community officials should design effective ways to communicate and educate residents about severity of obesity and the available community resources. They should make the citizens aware of low cost weight loss programs. They should provide accessibility to parks, walking paths, and community recreation centers. um, and this accessibility should be increased. These following recommendation can help prevent obesity. These are the following references I used to create this presentation. Thank you so much for listening.